Upstate Medical University in Syracuse, New York invites you to be the informed patient with the podcast that features experts from Central New York's only academic medical center. I'm your host, Amber Smith. Using low-dose radiation therapy to treat osteoarthritis pain is gaining favor with doctors in the United States. Here to tell us about how this works is Dr. Anna Shapiro. She's a professor of radiation oncology at the Upstate Cancer Center. Welcome back to The Informed Patient, Dr. Shapiro.
Thank you so much, Amber. I'm excited to be here and share this information with everyone.
So how did the idea of using radiation for long-term pain relief for osteoarthritis come about?
The idea of using radiation for benign conditions is not new. One of the earliest papers on this was published shortly after radiation was discovered over 100 years ago. And actually, in the United States, it's been used up until 1980s. In Europe, it continued to be used for all these decades, but in the United States, right around that time, non-steroidal medications were introduced and have become more popular. And so radiation fell out of favor for a number of reasons, one of which was some concern for radiation causing cancer, which we'll discuss later, but I don't think that's a real concern, but mainly because I think more physicians were recommending medications than non-steroidals that have sort of become more accepted in the market.
And patients are always looking for a quick fix if they can take a pill and take care of their problems.
That's right.
But here we are, 2025, and this is coming back in favor here. Why is that? And how does it work?
Everything old is new again. And so there's certainly patients that have contraindications to using non-steroidal pain medicines. And they're not without their own risks and side effects. The burden of osteoarthritis in the United States has increased over the years. And that has to do with a number of things, including our activity level and increasing obesity and other things. So we're talking about a problem that involves about 30 million people in the United States, or 1 in every 7 Americans will be affected by this problem. So it's a huge burden. And really, we don't have good therapies. You know, most osteoarthritis is managed conservatively, and it's basically symptom management, physical therapy, weight loss, some supplements, and eventually a patient would move to more invasive procedures, right, like steroid injections. And when arthritis progresses, they eventually get a joint replacement. I think it's only natural for us to look for other options. And in Europe, they have a very long track record of using this low-dose radiation that kind of piqued interest. And I have to say that every society, every meeting that I've been to this year and the rest of the year has had a program or at least a presentation on use of low-dose radiation for inflammatory conditions. So it's quickly gaining popularity. And when patients experience relief and clinicians see how happy their patients are, I think that in itself encourages us to use this treatment more and more.
So how does it differ from the radiation someone might get if they have cancer?
It's very different. In fact, I think we should think of this as a totally different form of radiation. So there's a spectrum. The type of radiation that we use for cancer is very high dose, really aimed at causing death of cancer cells. This radiation, low-dose radiation, is about 20 times less dose-wise than what we would use for cancer. At very low doses, we see a completely different effect on healthy tissues than what we see with higher doses. So radiation at low doses actually causes anti-inflammatory reaction and causes some healing. So the radiation works in a few different ways. When you have arthritis, you basically have erosion of the cartilage. When the cartilage becomes rough, that causes an inflammatory cascade. Cells called lymphocytes are recruited, and with them they bring swelling, and eventually the lymphocytes themselves cause increased inflammation and recruit other cells, and they cause an inflammatory cascade. So radiation basically kills those lymphocytes. It prevents the signals that recruit other lymphocytes from coming in, and they also prevent lymphocytes from leaving the blood cells to be able to enter this joint space. So it works a few different ways. But the idea is it basically decreases inflammation and prevents further damage to the joint. So it prevents progression of arthritis that causes your cartilage to continue to deteriorate.
Arthritis can affect a bunch of different joints. Could this be used on all of the joints of the body?
That's an excellent question. The only joints that we're careful about are the spine. So for some joints, we have good effective treatments. We know that, your knees and hips could be replaced. It's much more difficult to manage hand osteoarthritis, right? Because we really don't have a lot of surgical options. So I think that's a really nice niche for where we could look to use other options like radiation. For spine, we have to be careful because X-ray beam goes through and through. So if you think about the shoulder, if you think about the knee, the beam enters and exits. When we have a spine, when the beam enters from the back, it has to exit through a number of healthy organs in your belly. So we have to be careful. Some centers are using radiation for the spine very carefully, but even in Europe, they're very careful and they kind of pause before they use radiation to the spine. But all other joints, I think, are really good candidates for this type of treatment.
This is Upstate's The Informed Patient podcast. I'm your host, Amber Smith. I'm talking with Dr. Anna Shapiro. She's a professor of radiation oncology at the Upstate Cancer Center, and we're talking about low-dose radiation therapy to help alleviate certain types of pain. Now, who is a candidate for low-dose radiation therapy?
So ideal candidate would be someone who is interested in non-invasive options or someone who is trying to avoid surgery. I wouldn't say that radiation is a first line of treatment because I think it's very important to consider conservative management options, physical therapy, weight loss, and all these things that are sort of the culprit of osteoarthritis. But if you have a patient who is really not ready to have surgery or has tried a number of steroid injections and is not getting much relief, I think that's a perfect candidate. I have to say that patients with more advanced disease are less likely to see benefit from radiation because when you have bone on bone, severe osteoarthritis, it's very hard to reverse that. So I really do believe that in order to get the best benefit, it's better for us to see patients earlier on in the progression of arthritis. So I would say after someone has tried more conservative management but is not ready for invasive procedures.
Now, if a person has had radiation therapy for cancer, would that disqualify them from having the low-dose radiation for osteoarthritis?
I would say no, but you have to consider, we always take into account all prior therapies that the patient had. And if there's an overlap with the prior treatment, we will take into account the treatment that they had. But like I said, this is very low dose. We're talking about 50 rad, something on the order of 20 times less than what they would have seen. So we would take it into account, but I don't think that's a contraindication.
So can you walk us through how the treatment is done and how patients prepare for it?
Certainly. The first appointment is a consultation where we sit down, we go through the history, we talked about any causes for joint disease, what has previously been done, any prior treatments. We'll go over the x-rays and determine the severity of arthritis. I would examine the joint, and we'll talk about any possible risks and benefits. The next appointment is a planning session. We call it CT simulation. It's a CAT scan where we immobilize the joint. Oftentimes, we make a little device similar to a cast to keep the joint steady, and we design the radiation fields. After that, the treatments will begin in a few days, and the treatments typically are 6 sessions that are about 20 minutes each. And they're done every other day. So 6 sessions, typically a Monday, Wednesday, Friday, over a course of 2 weeks.
I see. How soon might someone feel relief?
Some of the patients feel relief right during treatment. But more typically, I wait about 3 months before we evaluate and determine whether a patient needs another course. Most studies in the European experience supports doing a radiation 2 or 3 times to get maximum benefit. So at 3 months mark, we would sit down and evaluate whether the patient got complete relief or not, and then determine when to do the next course. Again, because of the low doses, this treatment can be repeated multiple times.
What are the expected side effects?
Most patients surprisingly have no side effects. Some of the side effects that people think of when they're thinking radiation, such as skin reactions or hair loss, we really don't see at these very tiny doses. So personally, I have not seen any side effects. One of the things that we always think about with radiation is radiation causing a cancer. The type of cancer that we worry about would be a skin cancer, like basal cell. The risk is extremely low. In fact, if you review published literature, there's not a single case that has been reported, including in Europe, where they've used it for many decades. But, at least theoretically, I usually tell my patients the risk is 1 in 3,000 of developing a skin cancer, which is actually much lower than, going out in the sun routinely. So the risks are very low.
Are you finding that health insurers are willing to pay for this?
Absolutely. Actually, the health insurers, including Medicare, have been paying for this all along, even though this treatment wasn't as popular. This is not a new treatment when it comes to reimbursement, and it is covered.
Now, how long would relief last if someone goes through and maybe they do have more than one course even? I mean, will this have lasting effects of years?
Sure. If we look again at published clinical trials, I would say in the range of 70% of patients experience pain relief. It ranges between 60 and 90, depending on the severity of arthritis. Of those patients who respond, about 80% have significant and durable pain relief that lasts about 2 years. Of course, this is variable from patient to patient, but it's a very durable treatment.
So at the end of those 2 years, if you're still struggling, does having had low dose radiation preclude you from having a joint replacement or another type of surgery in the future?
Not at all. Not at all. In the surgical literature, there's no warning that having had this low dose radiation will cause any complications surgically if someone needs a joint replacement. In fact, many patients over the years eventually do go on to need surgical intervention, and it does not increase your complications.
So how do patients connect with you? Do they need a referral from their primary doctor?
So that's one way. I've had referrals from the primary doctor, from the orthopedic doctor or rheumatologist. Many patients also self-refer. Many of my patients who have been treated also refer their friends. So you can certainly call and make an appointment. 641755.
Well, thank you so much for telling us about this. I appreciate it, Dr. Shapiro.
It's a pleasure, and thank you for inviting me. And I'm really excited for this new treatment and helping so many patients with their joint pains.
My guest has been Dr. Anna Shapiro, a professor of radiation oncology from the Upstate Cancer Center. The Informed Patient is a podcast covering health, science, and medicine, brought to you by Upstate Medical University in Syracuse, New York, and produced by Jim Howe, with sound engineering by Bill Brokel and graphic design by Dan Cameron. Find our archive of previous episodes at upstate.edu/informed. If you enjoyed this episode, please invite a friend to listen. You can also rate and review the Informed Patient podcast on Spotify, Apple Podcasts, YouTube, or wherever you tune in. This is your host, Amber Smith, thanking you for listening.